If you're diagnosed with diabetes, you should listen carefully to this video. If you're diagnosed with diabetes and are given metformin or other types of medication for your diabetic condition to take for the rest of your life, you should listen carefully to what I'm about to say. If you're diagnosed with the condition and do not want to take medication for the rest of your life, you should stop this video, take a pen and a piece of paper. You're about to hear some groundbreaking, transformational knowledge which has helped hundreds of diabetic patients successfully nationwide. My name is Dr. Maz. I practice at Medwell LLC in Midland Park, New Jersey. We are a panel of doctors working together at one location. I'm also the author of this book, How to Live Pain-Free and Happy, Drug-Free, Non-Invasive, Non-Chemical, Non-Surgical Steps for Chronic Conditions like Diabetes. I've studied over 10 years of latest research in diagnosis and treatment of diabetes. I'm also trained by the country's leading expert, Dr. Michael Johnson, with functional endocrinology, functional neurology, and functional medicine. What if I tell you you may have been misdiagnosed? That means there is another reason that is causing your type 2 diabetes. What makes us different is we diagnose and treat you metabolically and neurologically. Majority of the patients who are diagnosed with diabetes have an underlying autoimmune condition disorder. That means your body's own immune system, which is supposed to keep you from getting sick, is actually attacks your tissues and organs and makes you sick. By identifying if you have an autoimmune condition, which most of us do, and getting rid of your autoimmune condition, many of our patients get off insulin and reduce their metformin levels. That is what we do. I'm here to show you a way that you can possibly and virtually eliminate taking medication and lower your blood sugar. We do not change or eliminate your medication. Your primary care physician or your endocrinologist will do that as a result of our treatment. You are about to hear how hundreds of type 2 diabetic sufferers have been helped successfully without the use of drugs or medication, and I have testimonials to prove it.
I'm having therapy done here at Medwell. When I first arrived, I was having lots of pain, taking a lot of medications, and more than I wanted to, and was uncomfortable on a daily basis. Since being here, the relief has improved, the medication has diminished, and I feel great now.
I've only been coming to Medwell about 2 weeks, and I was literally crippled when I came in and couldn't sleep at night. And I have to say that at this time, I could sleep all night, through the night, without pain meds. I don't use the cane. I just can't believe the difference between my condition when I came in and today.
The reason you're watching this video is because either you or someone that you care for is suffering from this diabetic condition. The purpose of this video is to inform you what is available to selected certified doctors and enable you to be able to enjoy life with your family and friends to the fullest. If your symptoms wax and wane, there's reasons behind that. You better listen to what I'm about to say. If all of your lab tests are normal and still feeling the symptoms, there are reasons behind that. If you take a list of medications and supplements and still feel horrible, there are reasons behind that, because you're messing up with your immune system and that's causing the problem. I do not want to be abrasive. Please don't get me wrong. Most people like to be nice than effective. I want to change your life and would rather to be effective. I could care less if you applaud for me after a lecture or saying thank you to me. We define a treatment plan that's second to none. We design proper diagnostic studies that mostly are done on site to identify the true cause of your problem. And by doing that, what we can do, we can deliver the treatment that you need. And the best thing about the treatment plan is it is painless, non-invasive, non-chemical, and drug-free. I'm very serious about helping you. My goal is to add value to your life so you're able to do what you want to do, to spend quality time with your family and friends. Let's go over diabetes. I want you to know every cell in your body has glucose and thyroid receptors. Thyroid, we're not going to talk about. That's a different DVD. Every cell in your body has glucose receptors. So what that means, when you have a glucose problem, every function in your body gets affected or slows down. Your brain function gets affected or slows down. Your gut function gets affected or slows down. Your thyroid function, your liver function. You feel fatigued. You have sleeping problems. You get neuropathy. You can't sleep. You can't lose weight. There are two types of diabetes. First type is diabetic mellitus. That's a metabolic disease. You cannot drug yourself out of a metabolic disorder. You cannot take enough drugs to fix a metabolic disorder. There is no drugs that works on a metabolic disorder. This condition prevents the body to make enough insulin. What insulin does, it turns food into energy. It makes you think properly. It gives you energy for the day. The organ that's responsible for that is the pancreas. Pancreas is an organ that makes insulin and turns glucose into energy. When you eat something, the glucose should go into your cells to be used as energy. If you do not have fuel, the energy level diminishes, and that is why the way you feel is the way you feel. How many drugs you should take to increase your energy or thinking capacity? Nothing. That's a neurological phenomenon which would be handled neurologically without the use of drugs or medication. The second type is type 2 diabetes. That is the #1 cause of blindness in the US. When is a good time to fix it? Now or when you're blind? Now or when you have neuropathy? Now or when you're getting amputated? That's the truth. You want to believe it or not. This is the time to fix it, not when you're blind. This is a serious problem. It's a #1 cause of kidney failure. 70% of peripheral neuropathy and amputations is because of this type 2 diabetes. 60% of sexual dysfunction is because of type 2 diabetes. This is a chronic condition associated with an autoimmune condition. That means your immune system wants to fight a condition and it cannot. And as a result, it starts attacking your organs. Most commonly, in your case, is your pancreas. Somebody else's case could be thyroid. How many of you have thyroid problem in addition to diabetes? It could affect your cerebellum. Your cerebellum is the back part of your brain. It is in charge of your coordination, thought process, balance, eye movement, postural muscles. How many of you start a sentence and you cannot finish it because you forget? How many of you actually walk to a room and don't know how you got there? These are a brain problem. We call it a brain fog. That means your brain physiologically, it's not working at its optimal level, and we need to bring it up. And we can bring it up in most cases. Your brain consumes only 20% of the glucose that you put in your body. all extra turns brain to brown color. Refined sugar is horrible. It's actually a neurotoxin. It's brain poison. It kills your brain. And at higher temperatures, it becomes to formaldehyde. Formaldehyde is what they preserve dead bodies in. We need to find if you have an autoimmune condition. In other words, we need to find out what is in your body, it's not working properly, which is causing your immune system to react and cause your symptoms that you're having. Because your immune system is attacking your pancreas, and your doctor keeps giving you medication for your pancreas to do its job. It will not work to fix the problem. If it did, you would have had been fixed by now. If it did, you would not have to take any more medication. Autoimmune condition must get fixed before anything else can get fixed, because it trumps every other chronic condition in your body. That is why most chronic problems, most people who suffer from chronic problems, they start medication, they take it the rest of their life. Thyroid problem, you start medication, you take it the rest of your life, because autoimmune condition is not diagnosed, because it's not fixed. So we may be able to help your diabetic symptoms naturally without medication, but I do not want you to get me wrong. I'm not here to stop or change your medication. That's your medical doctor's job who gave you that medication. Your immune system is trying to kill something for a while, and that is why you're feeling the way you're feeling. That is why you have fluctuating blood sugar. If one day you don't take the metformin, blood sugar raises up. Well, is that fixing the problem, or it's just managing it? If you're taking multiple medication, if you're taking multiple supplements, that could mess you up. I don't want to get into that now, but what happens, your immune panel, your immune system has two parts, Th1 and Th2. We have to see by diagnostic testing which one is dominant, Th1 and Th2. If Th1 is dominant, one protocol is followed. If Th2 is dominant, one protocol is followed. The problem is when you take these supplements, just for the heck of it, to make you feel better, you're stimulating both parts, Th1 and Th2, and that causes problems. And more confusion, because you're on supplements, you're supposed to feel better, and causes more stress. 90% of diabetic patients that we have seen, they're autoimmune. Most of them have a hidden gut infection, which was actually my case. You cannot drug yourself from a metabolic disorder or an autoimmune condition. You cannot take enough drugs for a metabolic disorder. There is no drugs for a metabolic disorder.
It's amazing the difference today, that my feet feel good, I sleep well at night. It's just incredible the results that I'm getting from Medwell. And I know it will continue, and I tell you, I look forward to my treatments. And the people here are so professional and so competent that it's just a pleasure to be here.
All autoimmune conditions are usually chronic, and chronic conditions are caused by combination of the following three problems. Problem one is oxygen deficiency. Now, oxygen is a fuel for your brain, and it's extremely important because brain does not store oxygen. Your muscles do. Your brain does not. And it needs constant amount of oxygen to work properly. And if you don't have enough oxygen, it will not work at its optimal level. Second problem is neurological misfiring. All chronic conditions are somehow associated with neurological misfiring. Your brain controls all your body functions and movements, and everything, it's handled by your brain neurologically. If your brain physiologically does not work properly, could it make sense that your hormone excretion will not be balanced? Of course it could. If the fuse box is not working properly, the pancreas may not do its job. And the third problem is a metabolic imbalance. If you have a bacterial, viral, fungus, protozoa, gut infection that your immune system is trying to battle and get rid of and it can't, it's going to attack another organ in the body and cause series of symptoms. Now, does that make sense to take care of the symptoms or get rid of the cause? That's what we do.
I've been in excruciating pain for a couple of years, not sleeping at night, and crying in my sleep, and I've been here 7 visits, and now I'm just about pain-free, and I just want to thank MedWell.
In some cases, your immune system could attack your adrenal glands. Adrenal glands are your stress glands. They're on top of your kidneys. They produce and manage cortisol. Now, cortisol attacks your hippocampus and causes you not to be able to know how you got to a place. It also causes sleeping problem. Cortisol should be at its highest in the middle of the day and its lowest in the middle of the night. You have to test your cortisol level. That could be the reason you can't sleep. Cortisol also wraps around pain fibers, type C fibers. There are nerve receptor fibers in your body and keeps stimulating them. So if you have excess cortisol in your system that stimulates the nerve fibers, that is why you feel fatigued all the time. That is why one day you have neck pain, the next day you have low back pain, the next day you have knee pain. Then you go to your doctor, the doctor thinks it's in your head. Those are for fibromyalgia and chronic fatigue sufferers. Then you take this medication. If this doesn't work, you take that medication. If that medication doesn't work, you excess the dose. Sometimes you see an ad on television and you take the medication to your doctor. The doctor says, well, you didn't respond to those 2 medications, why don't you take this medication? So it's a Russian roulette. If you take medication like metformin, also known as glucophage, that will not solve the problem. It just manages and masks your symptoms. I'm not telling you not to take it. I just want to alarm you about this. The problem will not get fixed. You have to fix the source, not the symptoms. In addition, metformin could cause malaise, could cause fatigue, could cause bloatingness, indigestion, gastrointestinal disturbance. Vitamin B12 deficiency, vitamin B12 malabsorption, elevated homocysteine levels, anemia, hair loss, on and on and on. What makes us different is we treat and help diabetes metabolically and neurologically. Why? Because if we treat it metabolically only, it's not going to solve. If we treat it neurologically, it's not going to solve the problem. That's why they go together to help the symptoms of diabetes. Because I don't want to label you, you have diabetes, you take this medication. I cannot do that. There is a reason your pancreas is not functioning properly, and most of the time the reason is not the pancreas. There is a good chance that your doctor is treating the symptoms that you're having and not fixing you. Why I say that? It's because most diabetic sufferers are prescribed medications and they need to take it for the rest of their life. In our office, our goal is to fix you and not your symptoms. You have these symptoms because you're a sick person having the sick body. Your body that is sick is causing your symptoms and it's showing its problem by having symptoms. Your symptoms, they don't make your body sick. Your body makes your symptoms. This is an eye-opening class, I hope, for you. We do life-changing care in 6 months.
I'm only agreeing to do this because it works so well, because I don't like to do this. I don't like to give testimonials, I don't like to watch them, because you'll find out for yourself. And I just want to thank MedWell because their system works. I think they should franchise it. It's proven, and I appreciate it.
I want you to ask this question from yourself. If I continue doing what I have been doing or I'm doing right now, will I be better or worse next year or so? If I continue doing what I'm doing, will I be better or worse next year or so? Most likely the answer is no, I'll be worse. Because if your current treatment would be for fixing your body, you would have been fixed by now. The reason no one has fixed you is because no one wants to fix your body. They all want to fix and manage your symptoms. I have seen patients who are on 7 medications. On 7 medications, they completed this care program that you're about to hear, and they do not take any more medication now. What we need to do, not to leave any stones left unturned. Like I said, what makes us different, we diagnose and treat you metabolically and neurologically. Our goal is to investigate the true cause of your autoimmune condition, get rid of it to improve your overall health. We define what is the actual cause of your problem. We design a diagnostic and treatment plan that fixes the cause. We deliver a metabolic and neurologic treatment with brain-based therapies and the supplements that take care of it naturally. There are certain lab tests that needs to be done to assess the true cause of your diabetic condition. Our job is to find what is that, because that is the part that is missed commonly in the medical community. If you have an autoimmune condition, like I said, you will not get better. It has to be addressed, and it trumps everything else. If your immune system is being attacked and not get treated, you will not get better, no matter what other chronic condition you have. So here is how we're going to attack this problem. First, we're going to do a blood test. Blood test is not the blood test that you have most likely done. It's comprehensive glucose and thyroid panel, metabolic panel, lipid panel, complete blood count, auto differentials. We test 55 different areas of your body's function. Immune panel, Th1, Th2 natural killer cell activity. I guarantee you that you have not had all the tests that I'm about to tell you. You have not done them. And if you have done them, it's not managed properly. There's some receptors, CD4, CD8s, that have to be checked. Now, with the blood test, I want you to realize something. Blood test, there is normal ranges that are given by the lab company called the lab ranges, and there are functional optimal ranges. Optimal ranges, if normal range is this big, optimal range is this big. We have to look at the optimal level. If something is supposed to be between 100 and 125, there's a difference if it's 101 or 124. You have to look for functional ranges. The next test that's extremely important for most of our patients we do, it is a food sensitivity testing. We have to see if your autoimmune condition and if your autoimmune condition is caused by food sensitivity for gluten, eggs, milk, soy, or yeast. You will not get better if you keep putting gluten in your body and if you're gluten sensitive, no matter what medication you take. You may feel fatigued, you may have pain, you may have indigestion, you may have bloatiness after eating a meal, you may have mouth ulcers. Those are all symptoms of food sensitivity. There is only one way to see if you're sensitive to these foods, and the way is to get tested. It's not by how you feel. You can't say, oh, Dr. Miles, I feel good, I'm not sensitive to anything, I feel fine. The only way to get tested to see if you're food sensitive is to get tested. We have to test you for gluten gene. We have to test you for casein sensitivity. These are toxins that if you're sensitive, you have to get rid of it for the rest of your life. Because the only way to know it is to get tested, and the only way to get rid of it is not to eat it. I don't want to waste your time. I don't want to waste my time. I want to get you better so you have an increased quality of life. Next, we have to do adrenal stress index. Most of our patients get that if there is a need for it. Adrenal glands, as I said, they're your stress glands. They're on top of your kidneys. They manage cortisol production. If you have high cortisol in the middle of the night, no good. That's what the reason is that you can't sleep. We have to test your hormone panels. We have to test testosterone, progesterone, growth hormone, estradiol. If you have off hormone balance, that could be the reason you're having all these problems. Because hormone levels are extremely important, especially in controlling diabetes. You may have H. pylori. That's why you have to do gut function testing. You may have a leaky gut syndrome. Leaky gut syndrome is a condition that the inner lining of your gut is going away. Number one cause of it is American diet, McDonald's, Burger King, diet soda, high sugar levels. So we have to check you for that. If you have a bacterial, viral, parasitic, protozoa, yeast infection, that could be attacking your immune system. So your immune system wants to fix it, it cannot fix it, it attacks your pancreas, it attacks your thyroid. So we need to get rid of that before we can control other symptoms. And that is what we hope to do for you, and that is what our goal is. I want you to know something. This is something interesting, that your gut does not have pain receptors. If there is a problem with your gut, it bloats. You get indigestion, you get inflamed. Same thing with your brain. Your brain gets inflamed, it changes its color. That's why I said high glucose makes the brain to a brown color. You get a brain fog. You cannot think straight. You get to a place you don't know how you got there. You mess up calling your children's name. And obviously you know your children's names, but you mess up. That's called a brain fog. That's why we do neurological treatment in addition to metabolic treatment. The problem is that people are so sick and they think there is such a thing as a normal headache. There's a normal lack of sleep. There's a normal arthritis. None of that is normal if your body is not sick. And that is why we do complete neurological evaluation. Neurologically, we need to examine and test your body to see how your brain works physiologically. These tests are like, for example, having your eyes closed, eyes open, stand still, doing neurological maneuvers, testing your balance, watching your eye movements. These are all indicating factors for us. We can check your gait going back and forth. In addition to that, we need to check your oxygen level. Now, oxygen level, we need to be checked neurologically, not only cardiovascularly. Because your primary care physician, if you go and ask your primary care physician, somebody from Medwell said that my oxygen level may be low, they test you, they say, no, it's normal. That is the test to see if your cardiovascular system has enough oxygen, not your neurological system.
Dr. Maz is one of the most caring, compassionate people that I've ever met. Not only is he one of the top of his profession and able to truly help people, but he really cares.
So, how do we treat your autoimmune condition to improve your health? We treat you metabolically and neurologically based on the results of the tests that we have done. The treatment protocol that you're going to hear right now has helped hundreds of diabetic patients during the past decade successfully. First is neurological treatment. If your brain works properly at its optimal level, your symptoms may dissipate just because of that. If you put you off gluten, if you have gluten sensitivity, it's supposed to be from 0 to 10. I've had patients that were 400. Get off gluten, 78% of the symptoms disappear. Just because of that. So, neurological is important because if your brain works at its optimal level, your symptoms may disappear or at least get better. Now, brain needs two things to survive, to work great. It needs fuel, it needs activation. Enough energy and enough signal production to work properly. The energy part of the brain comes from two parts, glucose and oxygen. Glucose is handled by what you eat, but oxygen is extremely important. Brain does not store oxygen, as I said. Your muscles do. So what we need to do, we need to make sure you have enough oxygen. But the problem is, as you age, over 25 years old, your ability to utilize oxygen diminishes 1% a year. That means if you are 50 years old now, your ability to utilize oxygen has diminished 25% already, and next year will be 26%. So most of us are oxygen deprived. How do we handle that? We give you supervised oxygen treatment by our doctors on site to increase the oxygen level, and we have had phenomenal results. In addition to oxygen treatment, we may give you visual stimulation to make sure your brain works at its optimal level, olfactory stimulation, that's a sense of smell, auditory stimulation, sense of hearing. We're going to test your brain, right brain versus left brain. As you know, right brain controls left side of the body, left brain controls the right side of the body. So we give you auditory stimulation to the opposite side. We may do balance and mapping treatment to make sure your brain works at its optimal level. The more you can balance yourself with your eyes open, with your eyes closed, we have different sophisticated computerized devices and units over here at our site that challenges your balance, which works really well to prevent falling. In addition to all the neurological treatment that we do to make sure your brain works at its optimal level, now we have to do metabolic treatment based on the results of the tests. First and foremost important metabolic treatment is glutathione treatment. Glutathione is a natural antioxidant in the body. Antioxidants are essentials to get rid of free radicals. Free radicals are bad. Antioxidants are good. So what happens? Glutathione is a very strong antioxidant. Actually, it's the strongest antioxidant that I know of. We give you supplementation of that to increase the antioxidants of the body so your body's immune system gets strong. You know what destroys it? It's Tylenol. It's NSAIDs. They destroy antioxidants. So what we need to do, we need to replenish and replace it. We have to give you specific supplements based on your needs and results of the tests that we do to get rid of your autoimmune condition naturally before you get other treatments. You may need hormone treatment, you may need progesterone, you may need estradiol, you may need testosterone, growth hormone. Based on the results of the test, we're going to go ahead and give you those. So ask yourself this: how is your diabetic condition affecting your job, affecting your finances, relationships, families, activities that you want to do that you can't? What is it costing you in terms of money, in terms of time, in terms of happiness, in terms of not being able to sleep? Where do you picture yourself in a year from now? Do you think it's going to get better the way you're doing it? Do you think with the medications that you're taking, it's fixing the cause? Where do you picture yourself in 3 years from now, in 5 years from now, if you don't take care of this? What is it costing you not to be able to do what you want to do? If you're serious to correct it, you need to contact our office. We have two ways that people can contact us. Our website is www.askdrmaz.com. That's ASKDRMAZ.com. And they can call us simply to the office at 201-848-8000.
My name is Ellen Hart, and I'm happy to say in the visits that I've had at Medwell, I have come a long way. My first appointment, I needed assistance from the car to hear. How I got into the building, I don't even remember. Now, I am walking on my own. I'm able to dress myself without screaming in pain. I just don't know what else to say except that I am almost 100% mended. and it's thanks to Medwell. My pain is zero in comparison to the excruciating pain I had when I came in. And I'm grateful. The cooperation that I've had from the help that I've had here, every one of them, one more pleasant than the other. I cannot say enough.
One of our new patient coordinators will be glad to help you. If you don't care about your health, if you don't care what's going to happen to you, do not call our office. I do not need to do this anymore. I do this because my passion is to help people to live better and add value to your life. You can get treatment or not. It's not going to make a difference in my life, but it's going to make a difference in your life. Your health is not your employer's responsibility. Your health is not your government's responsibility. Your health is not even your insurance responsibility or your spouse's responsibility. It is your responsibility. Sometimes people who are skeptical from care, they come and tell me, Dr. Maz, or they ask one of the doctors in the office, maybe I'm going to go about this treatment and talk to my primary care physician and see what he or she has to say about the treatment. My response is that if your doctor knew about what I'm telling you, you would have been better by now without taking any more pills or medication. Your doctor is treating your symptoms and not fixing you. There are only a handful of selected certified doctors in the northeast of the United States who are trained in what we do. If it makes sense what we have said to you, call our office. Or at least go to a doctor who understands functional neurology, functional endocrinology, and diagnoses metabolic neurologically. If your doctor can do that and knows all the lab work, knows the blood lab panels, knows the adrenal stress index, the specific markers that needs to be run, the specific hormone panels, food sensitivity testing, and more importantly, you need to find a doctor who knows how to manage your case on the results of these testings based on functional neurology and functional endocrinology. If you believe your doctor who has not run these tests for you, you believe he or she can help you to get rid of the root cause of the problem without taking any more medication, you might want to go back to him or her. Otherwise, we're here to help you. That is, if we accept you for care. Because we don't accept everyone for care. We accept only the people who we can help. I'm asking you permission to help you. If you're serious about getting rid of your symptoms and get your symptoms handled, our office is for you. Call 201-848-8000. When you come to our office for consultation, you may get tested and start treatment the same visit or the following visit based on how busy we are. Unless you're coming out of the state, then we'll, as a courtesy, we give you treatment and start you possibly on testing the same visit. Can we guarantee the care is going to work? Absolutely not. Are we successful? Yes, very successful. This is Dr. Maz saying thank you for watching this video, and I'm looking forward to seeing you in the future. You can call us at 201-848-8000. Yes, we accept most insurance plans, and God bless you and your whole family.